Hi everybody, my name is Brittany Zeller.
And I'm Megan Tuttle, and we're fourth-year medical students at Lincoln Memorial University doing our clinical rotations here at Henry County. Sex can be a very uncomfortable and awkward thing to talk about. We are fully aware of this, but today we're going to answer a few questions that you may have. Hopefully we can give you some information.
Okay, so Megan, what are some things that you would want to know when you decide to start having sex?
So sex can be a very big deal. It is a big deal to everybody. There's a few things that you should absolutely know. One is that you need to be educated on how to protect yourself from pregnancy and STDs. The number one thing to do that is with condoms. There's also plenty of birth control options. We're going to talk about birth control later on. Another thing is the emotional aspect of sex. Sex can be a very emotional thing. You and your partner share a special bond when you have sex. It's something that will carry on with you forever. So you have to be emotionally mature enough to be able to have sex. Another thing is consent. Consent is by far the number one most important thing to think about when you're having sex. So consent is when you tell your partner that you are okay with having sex. Sex is more than just intercourse. It can be oral, or it can just be any intimate physical contact. So you and your partner both need to agree on when it's time for you to have sex. And you also have to respect your partner's wishes. If they do not want to have sex, then you do not have sex. It is a mutual agreement that you both need to have. And another thing is that just because you're in a relationship with someone, you should not assume that consent is applied. You always need to ask your partner if they're ready to have sex, if they want to have sex, and you always have to respect your partner's wishes. One final thing to remember about consent is that if you have sex without consent, it is not just sex. It is rape or sexual assault. You can be charged criminal offenses in the court of law. Okay, the next question is, what are the many different types of birth control?
So as Megan said, there are a lot of different types of birth control that you can try, and it's a trial and error. You have to find what works for you, and that's important for you to work with your doctor to try and figure out what works best and what doesn't work for you. So the first type is a condom, and that can be used to protect you from both STIs and from unwanted pregnancy. So it's important for the male to remember the condom every time he uses sex. Another form of birth control that you can use is the pill, and you have to take that every single day at the same exact time. So that can be hard to remember for some people, but if you can remember it, it is a good form of birth control. Another form of birth control is the shot. That one will last you about 3 months, and you do have to go to your doctor to get that shot. But it is another form of birth control if you don't mind getting a shot. Another one that you can try is an implant, and that will go in your arm. That will last you for about 3 years. So that's a good choice for someone who wants a little bit longer lasting birth control, so they don't have to remember a shot every 3 months or a pill every day. Another form of birth control is an IUD. There are 2 different types of IUDs. One is a copper IUD, and that one will last you 10 years, so that's a good long-term choice. Another choice for you could be a hormone IUD, which lasts about 5 years. So any of those options that I listed previously would be good options for you. You just need to talk with your doctor and work with your doctor to figure out which one works best for you. One last thing about birth control is that it can help you with different things besides birth control, like regulating your periods and pain with periods.
Okay.
And another important question are, what are the different types of STDs?
So there are many types of STDs. Common ones are gonorrhea and chlamydia. They both present in similar ways with just irregular discharge from either the vagina or penis, and you can have pain with urination. Another common one is herpes. Herpes present with painful ulcers either on your genitalia or in your mouth. Another one is syphilis. Syphilis presents with a painless ulcer on your penis or vagina. More serious STDs are HIV, Hep B, Hep C. These are the top of the top serious STDs, so it's very important, just to reiterate again, condom use is very important. It is the only thing that can protect you from an STD. It is very important if you notice any irregularities in your body, whether it's discharge, sores, anything, If you notice anything that's different than your regular normal body, it's very important that you go to your doctor and you tell them right away. It can be embarrassing, it can be awkward, but I promise you there are medications to treat these diseases that can help them from progressing to something more serious. So the last question, Brittany, is when should one go see their OBGYN?
Okay. So it's important to go see your OBGYN when you decide to have sex. You want to be able to talk to that doctor about the importance of birth control, as we said before, and screening for STDs. So when you decide to have sex, it's important to schedule that appointment with your OB-GYN to talk things over. It's also important for everybody, even if you hadn't had sex yet, when you turn 21 for females, to go get screened for HPV, and that's when you'll start to get your pap smear. So it's important for everybody, again, even if you haven't had sex, to go do that. You can also go to your OB-GYN or the health department or your family doctor if you have any kind of irregularities with your period or any kind of the symptoms that we talked about before with the STDs. So we want to make sure that you have an open conversation with your doctor or the health department, which can provide you with screenings as well as birth control for a low or reduced price.
We hope that you find this video helpful. We both understand that sex is a very awkward and uncomfortable thing to talk about. If you have any questions or concerns, you can always reach out to your doctor. I promise you, whatever you tell your doctor, they will not be shocked. They will not be surprised. They will be happy that you came to them to ask them these questions. And if you don't feel comfortable enough to go see a doctor, you can always talk to your parents. Again, we understand that it can be an awkward conversation to have with your mom or dad or grandma or even sister or brother, but it's important that you ask questions to protect yourself from things that can be preventable.
On behalf of Megan and I and Henry County Medical Center, thank you for watching. Stay healthy and stay safe.
Bye.